Medfit Rehab founder Joanne James is a medical exercise specialist. Medfit Rehab, restoring strength and movement, making a difference in people's lives. 647-259-5481. Columbus Center, Athletic Department, Dufferin and Lawrence, medfitrehab.com. If you are suffering from a host of medical problems, diabetes, osteoporosis, neurological, cardiovascular disorders, or cancer, Joanne James, medical exercise specialist for over 25 years, can develop an exercise program that will make your post-rehab effective and inspiring. Medfit Rehab will provide a hands-on, professionally supervised conditioning program. Medfit Rehab, Columbus Center, Athletic Department, Dufferin and Lawrence, 647-259-5481, medfitrehab.com. Hi, Michelle. How are you this morning?
I'm very well, Zelda. How are you?
I'm fine. The first day of May.
Yay!
Yeah, that's about as weak. Nice, right? That's about as weak a yay I've ever heard. But never mind.
Yay!
Okay, hope for the future. Anyway, all right. This question: the side effect free prescription that lowers your risk for 5 major diseases.
Yes.
Okay, so
Wild
explain
guess
that.
What that could be.
No, I have no idea. I think it
really?
could be exercise. That's what I think.
There you go. That's right.
Okay.
Yeah, we know that exercise has been proven empirically and anecdotally for helping to prevent and manage a variety of conditions. Now, when we talk about the 5 main ones, unfortunately, we're very well aware most Canadians have some form of a chronic disease. In fact, more than half of us do. Some report up to 2 or more. We're going to focus today on the following 5, briefly: osteoporosis, diabetes, cancer, heart disease, and arthritis. Osteoporosis. The key with osteoporosis, and may I also add here too, exercise is great from a preventative standpoint and across the lifespan. But we also recognize that it's not a cure-all. There are some things, God forbid, that in this life that we understand we do not have control over. But we do our absolute best to put into place measures that will lower our risk or at least soften some of the effects. So, for example, some people are predisposed to certain things. We can't say that exercise will make sure that you will never suffer from that, but we hope to lower the odds. Okay, so having said that, osteoporosis. The main goal for preventing osteoporosis is we want everyone, especially the women, but men too, of course, to achieve their peak bone mass. That happens very early, 16, 18 years old in girls and early 20s in boys. You need weight-bearing, impactful exercise. If you don't achieve that peak bone mass at that early age, unfortunately, it doesn't get any better. You can't build extra bone once you've passed the point of where you're supposed to have peaked. So the best that we can do, where we find a lot of women especially, is that the best we can do is maintain what you've got, right, and help to strengthen the muscles, et cetera, because the risk for a fracture is higher if your bone mass is less, but it doesn't necessarily mean that you're going to fracture. So weight-bearing exercise is stuff where you're bearing your own weight. So you're walking at a good pace, or maybe you're doing step activities or something like that. And impact is good. It's not necessarily jumping up and down wildly like the old-style aerobics classes, but the bones they need stress to get better, get stronger. Number 2.
How do you do that? I mean, how do you change your body mass?
Well, it's your bone mass.
Your bone mass, okay.
Bone mass, yes. If I said body mass, I approve. That would have been a mistake. Yeah, you want to improve. Now, mind you, your body mass is your weight and your weight distribution, right?
Yeah.
So to some degree, yes, we can change that too. But there is sort of see, ideally, we would all have a bone density test done early in life when we're supposedly at our peak, because that is the ideal. Because, then we know this is the highest amount, this is the strongest my bones have ever been, and then you can kind of go from there. Most people, because of the way the healthcare system works, because of a lot of other factors, they're not getting a test until they're in their 40s, 50s, 60s. So all you're doing is reading where you are. Some people may have never had really high bone mass, but they're strong, right? Anyway, we'll move on from there to diabetes. The exercise's role in there is quite simply and very importantly, to control blood sugar, how glucose is transported through the body. It also helps to control your weight, which is a very important thing because it's never a good thing to be overweight, but with diabetes that just sort of complicates some of the symptoms that you might have. So again, very important, and even the newly published criteria or protocols for diabetes, going more than 2 days without exercise is considered a big no-no, just because of its effectiveness on regulating blood sugar. If you go more than 2 days, you miss the effect, and you find yourself and your blood sugar and your whole system kind of off.
Well, I think that, you really need to work with an expert, a specialist like, someone like yourself or Joanne at Medfit Rehab, not to take this on your own, but to follow the instructions because, as you say, you can't change your body shape that much, but you can alter it and you can make it more slender and more willing to do the things it needs to do in life.
Mm-hmm. That's true. Yep. Now, the other couple is quickly, heart disease. People forget our hearts are muscles, and we need to strengthen them. So we need a combination of aerobic and anaerobic exercise. Aerobic means with oxygen. Anaerobic is without. Aerobic would be walking at a steady pace for, 20-plus minutes. Anaerobic is that quick start and stop, which is important for everybody. It's important for reaction time as you get older. It's also important so that your muscle, the heart muscle, gets stronger so it doesn't have to work as hard at what we consider to be our quote-unquote normal activities during the day. When your heart is weaker and it's not used to pumping blood in an efficient way and the blood flow is not really that great, your circulation then is weakened and it affects your energy. It affects everything. With arthritis, we want to improve range of motion. I mean, that's the biggest complaint, both rheumatoid and osteoarthritis. In some people's case, it's the crippling, awful pain where people can't hold things anymore, they can't grip things. And, of course, the days, they ebb and they flow in terms of how they're affected. So the best we can do with exercise is to help improve the range of motion. And there are things that you can do for the muscles in the hand and the wrist and the forearm and the fingers to enhance, again, blood flow and also just improving the range of motion. So hopefully some of the pain is reduced or at least is not constant, right?
Okay, well, we're way over time, but you have so many interesting things. The most important thing is that if you want to live a life that's a little more, interesting and you can do more things, limber up and let Medfit Rehab help you do that. And I mean, that's about the best we can do. You can't be a miracle worker, but you can be close.
Exactly. We're as close as you can get.
Absolutely. Happy May Day to you. Have a great day.
You
Take
too, Zelda.
care.
Take
Bye.
care. Bye-bye.
Joanne James, founder and medical exercise specialist of Medfit Rehab, will improve your overall health through medical exercise. Contact Joanne James, 647-259-5481, Columbus Center Athletic Department, Dufferin and Lawrence, medfitrehab.com.